What this is showing you is the causes of death in the United States. This is 2005. I guarantee in 2009, the ranking is the same. The percentages might be slightly different. Cardiovascular disease is the #1 cause of death in this country. Cancer is #2. Stroke is #3. You see diabetes there at #6. But the truth is that diabetes is hidden because the #1 cause of death for people with diabetes is cardiovascular disease. So that cardiovascular disease is hiding diabetes, and I'll explain to you why that's so important, the diabetes connection. In 1900, the life expectancy in this country was 47 years compared to 77 now. Our life expectancy has increased 30 years in the past century. The things that killed people in 1900 were mostly infections and injuries. Those infections might be infections of the lung, otherwise known as pneumonia, infections of your gastrointestinal tract, and those things happen. They're happening in Haiti, I guarantee you. But the things that caused those were bacteria and viruses. And we have those around today, but because of vaccines and because of antibiotics and antivirals, we're able to manage those. What is the equivalent of bacteria and viruses when we're talking about cardiovascular disease, cancer, stroke, and diabetes? At the top is smoking. The second one is high blood pressure, physical inactivity, high blood glucose, high LDL, high dietary sodium, low dietary omega-3 fatty acids, high dietary trans fats, alcohol, low intake of fruits and vegetables, and low polyunsaturated fatty acids. Virtually all of those in some form or fashion, all save 4, are directly related to food intake. And those are preventable causes. In other words, if we did a better job around those things, if we didn't smoke, or if we consumed more fruits and vegetables, it could very well be that we could change the pattern of mortality in our country. So let's talk about obesity for a moment. In 2007, this is what the obesity map looked like in the United States. The darkest red represents states where more than 30% of the adults are obese. 30% obese. Not overweight and obese, obese. They're carrying, for someone who's 5'4", carrying 30 more pounds than they should. So if you're 5'8", it's going to be more than 30. If you're 6 foot, it's going to be more than that, et cetera, et cetera. It's a BMI over 30. There's only one state in the country where less than 20% of adults are obese, and that's Colorado. What this shows you that you can't see is that now there are 6 states where the obesity rate is over 30%, and that includes, I believe that's West Virginia, that's Tennessee, that's South Carolina, Mississippi, Alabama, and Oklahoma. If we don't do something about obesity and the fact that it leads to diabetes and all the chronic diseases it does, ensuring everybody isn't going to make a difference because they're all going to need to see the doctor. And what we need to figure out is how we reduce the demand for medical care, not artificially by jacking up the price, but by helping us all be healthier. Now, getting back to the medical costs of obesity, $147 billion in 2008. That's a bunch of money. And when you do the math, that comes out to about $500 per American per year, a premium, if you will, because we are at a very high level of obesity. And to put it in context, if you didn't know, compared to other countries, we are on the more obese side. In fact, of the developed nations, we are, I don't use the F word, we are the most obese nation of all of the developed economies. The medical care costs just from being obese, not to mention having diabetes or anything like that, adds $1,500 per year to the cost of medical care. When you throw in diabetes and some of the other conditions, those numbers start getting really, really very high. there's now 40 million Americans with prediabetes. That means their blood sugar is not so high that you call on people with diabetes, but it's above normal. It's above healthy. So a little science. There's a program out there, the Diabetes Prevention Program. It's research that's been done, New England Journal of Medicine, 2002. And I'm not going to bore you with the results. Bottom line is, diabetes can be at worst delayed and at best prevented. And in that study, what they did is they had a population of people with pre-diabetes. So they took this group, they divided them into three. One group, normal, everyday, usual care. Whatever they are getting, they continue getting. Second group was given a medication named metformin. Some of you may recognize that name. It's also called glucophage. It's the first-line drug for people with diabetes, but it turns out that it can delay a person with prediabetes from becoming a person with diabetes. And then the third group had healthy lifestyle. Now, I'm going to tell you what the healthy lifestyle was, because sometimes these healthy lifestyle things are things no one in their right mind could really do. But this was 150 minutes of moderate to vigorous physical activity a week. Now, let me tell you what moderate physical activity is. That's walking with a friend fast enough that you can feel your heart rate going up, but not so fast that you can't have a conversation. That's not 150 minutes, if it's about brisk walking, is not that outside the possibility of many Americans. And then the diet was also a diet that was high in fruits and vegetables, low fat, not crazy low fat, but low fat, and easy to do. The lifestyle was almost 2 times better at keeping people from developing full-blown diabetes than the medication was. And that the reduction in incidence was almost 60%. The cost to do that is about 1/30 the cost of the medication. In other words, healthy lifestyle is possible, and it doesn't cost that much money.